All right, hello my darlings, it's Michaela. So I've been wanting to make this video that has been inspired by an ER room doctor who is quite tall. And so at any rate, when she came in, we talked about discomfort and how she's using her body. So what she talked about was that when she often addresses, interacts with patients in the ER, they're on gurneys, and there's this huge height differential. So what she does in an effort to basically come down to create a feeling of equality is she slouches. And so the truth is, people that are tall tend to slouch. And it's because they're higher than others. And so there's it seems it's pretty understandable in a human dynamic, a body language, a power dynamic kind of way to want to establish equality or to not want to dominate. That's not the case for everybody, but for a lot of tall people, that tends to happen. So an alternative, should you wish to come down. So for her situation, she brilliantly talked about the fact that she would squat by beds, by gurneys, in order to be closer to the same level as her patients. Amazing. And also keeping the integrity of her spine. So good. But what we also talked about was how to get lower while standing, while not compromising the spine. So this is true. So for a lot of people, whether you're like in a casual situation or maybe this is more appropriate for a casual situation, but instead of breaking to come down in the spine, breaking at the hips is infinitely more sound and comfortable. So if you are someone that is tall and that wants to be kind of lower in a social situation, well, both people are vertical, sitting back in your hips and sometimes even leaning back a little bit can kind of help you to be lower, but to not be pulling on little muscles that aren't meant to support you. Additionally, what we talked about for her was to think about sitting back in a slightly more dramatic fashion. So having one foot in front of the other to come down, rather than this full commitment of a squat, to come down to speak with her patients. And the thing that was so lovely about the motivation to do this is her awareness about this imbalance. So, you know, she is a physician, she's coming in with a sense of authority, she's quite tall to begin with, and she's treating people that are some potentially feeling powerless, they are lower, potentially in pain, confused, feeling quite vulnerable, afraid. And so her desire to kind of level things out and to create an interaction that feels more comfortable, that hopefully generates more trust, is just wonderful. Like, that is 5 stars for bedside manner. Amazing. Anyway, but we talked about this other option. And so, like whether you're at a computer or a car or at your desk or taller than average and interacting with someone that's a little shorter than you, making a point to keep your spine straight, to keep joints in alignment, and to utilize this hinge versus other little joints is going to keep you so much more comfortable. So if you want to know more about things like that, if you would like a Bible about such concepts and behavior for every aspect of your body, I wrote an ebook, I've been talking about it for a while, called Power and Pain, and really it's meant to help a body either prevent injuries, how to manage something long-standing, and then essentially how to be most powerful in any move. So I will link a little thing below. But then also, should you feel like you have a more complicated situation or want more individualized attention, that's something that I also do outside of Still Point, 2 training sessions by the same name, Power and Pain. But it's meant to be an education that lasts a lifetime and is used throughout your whole lifetime. Okay? So that is it. Please be in touch for any reasons. I hope that was helpful, and love to you all, and until next time.